The honourable member for Innisfail, Sylvan Lake, followed by Calgary Northwest.
Mr. Speaker, last February, the Health Quality Council recommended that Alberta Health reduce hospital occupancy rates by 85 to 90%. This means freer flow through emergency departments and progress toward hitting the 8-hour wait time benchmark that everyone agrees is a critical measure of success. The Minister of Health ordered Alberta Health Services to reduce occupancy rates to 95% by October 31st. That was yesterday. Has that target been met, yes or no?
Honourable Minister.
Mr. Speaker, I'm pleased to report to the House that Alberta Health Services has made tremendous progress toward meeting those targets. They are in the process of preparing a final report, which I'll be pleased to share with the Assembly regarding the results on that directive, as well as the one on reducing the number of alternate level of care patients in our major hospitals. They have done this, Mr. Speaker, through a collaborative effort at the site level, where administrators and clinicians and other support staff have worked together to design processes and procedures to achieve these objectives locally.
Honourable member.
Mr. Speaker, hospitals typically see a major reduction in emergency department visits over the summer months, when major health issues like influenza and pneumonia aren't as prevalent. How will the minister move toward hitting a target of 85% during the much busier winter season?
Honourable Minister.
Mr. Speaker, we make no apologies as a government for setting aggressive targets within our healthcare system. We are very well supported by a health delivery organization, Alberta Health Services, which is committed to doing that. Mr. Speaker, as I've said, there will be a report forthcoming from Alberta Health Services describing the very, very good work they've done across the province through empowering our clinicians and our support staff and our administrators to work together to deliver better results for Albertans. They've done so in the past. They will continue to do so in the future, Mr. Speaker.
Honourable member.
Mr. Speaker, this government constantly claims to be open, accountable and transparent, but it's almost impossible to track their progress on meeting many of these Health Quality Council recommendations. So, will the Minister of Health commit today to tabling in this House regular monthly updates of occupancy rates of all Alberta hospitals?
Mr. Speaker, Alberta Health Services and the Alberta Health System is one of the most open and transparent in the country when it comes to sharing data. As the honourable member should know, there is information readily available on a variety of topics on the internet with respect to waiting lists, with respect to times to treat for various procedures, and with respect to our progress in primary care, among many other topics. Mr. Speaker, the information is available. It's available to the honourable member without the benefit of question period. I encourage her to review it and perhaps succeed in asking better questions.